Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, new treatment options for people with varicose veins or any unsightly veins, and especially painful veins, even ankles that have ulcers. There is hope, according to my first guest, Dr. Hamilton. Dr. Hamilton, welcome to the program.
Well, thank you very much, Randy. It's a pleasure to be here.
All right, big topic. You're an interventional radiologist. Now, before we get into today's topic, big topic, tell us a little bit about your practice. I mean, who's the typical patient that you see?
I have a couple of different groups of patients that come in mainly. One, it's women that are about 30, 40 years old. They've had a couple of children. They have jobs, involve a lot of standing up. And they've got these veins that they hurt, they ache.
Is that right? You know, because going into this, I told you on the phone, this seems more of a cosmetic issue. You said that it's not the case.
No,
really?
There's really a lot more to it. Most people do just see this as a cosmetic issue, but these veins really impact the way that these people work. I mean, they're at work, they've got to sit down, they have to elevate their legs.
How do they describe the way it feels?
Usually as a heaviness or an achiness, sometimes cramps. Usually not as a sharp pain, but it can be.
So even in their 40s?
Exactly, even in their 40s,
right?
even in their 30s. And so that's one group, mainly these women that come in at that age. Men have the same kind of problems, but they just don't go to the doctor as much as
put it
women.
off.
So they just put it off. And then another category of patients that I see a lot of are elderly patients in their 60s, 70s, 80s. They've had varicose veins for decades, and they've just gotten progressively worse. They were either told or thought that nothing could be done to treat them.
So even the big ropey veins can be done non-surgically these days?
Even the big ropey ones are done non-surgically, and those are the people that end up having excellent results and are
those
very
even
happy.
easier, by the way, than the smaller veins?
In some ways they are easier. They really, the benefits that those people get are tremendous, and so they're very happy people once those get treated.
Where do you stand on technology? I mean, do you have all the new stuff?
I do.
The next generation of whatever's being done to get rid of veins?
I do. And in fact, I've done all the different kinds of new technology. When the laser was the new technology, I've been doing that. The laser that goes on the inside of the veins. Currently, I'm using radio frequency generated heat to
So is that the new
close
hot,
these veins.
most effective way?
That's the newest, most effective way with the least amount of pain. The lasers is very good, it's very effective, but really it's overkill. It heats up the vein to about 800 degrees on the inside, and it causes a lot of bruising and discomfort. And
so you don't use it anymore?
I don't use that. I've converted over to this radio frequency ablation technique, and I use ultrasound guidance with that, and the combination's fantastic.
Let's talk about your background, by the way. And I want a lot of questions about, you know, what you're doing with the big ropey veins, how, you know, and also with the smaller veins, and how do you keep them from coming back? But first, your background.
Sure.
Your father was a doctor.
Yes.
Your grandfather was a doctor.
My grandfather and my great-grandfather and actually my great-great-grandfather. They were all.
Right? That's interesting.
They were all in Texas. We've got 5 generations of Texas doctors.
Did you always want to be a doctor?
No, I did not. As a matter of fact, I started out in economics and then changed my mind and then went to medical school.
Interventional radiologist.
Yes.
What is it, and why does it equip you to do veins very well? Because I didn't quite get that. Why?
Well, a lot of my background is a diagnostic radiologist. I do a lot of ultrasound, and that really lets me sort out what's wrong with the veins. Is the blood flowing the right way? Are the veins too big? Are they too small? And then interventional radiology is where I do image-guided procedures.
Let's begin with varicose veins. Okay, so a patient goes through with varicose veins. What takes place on day one? What do they want to know? I mean, they must ask you the same thing every time.
They do, and just starting with day one. When they come in, I do a standard history and physical, and I talk to the patients about their veins. You know, how far can they walk? Have they always been able to walk that far? I start to find out that their legs have started, you know, over a period of years, feeling heavier, they're more tired, they've got to elevate their legs more often, they just can't do the same things they were used to doing.
Isn't it just part of aging, though?
That's what most people chalk it up to. They assume that it's part of aging, or I've gained a little bit of weight, and really it's not. When they have these bulging veins, it's a circulation problem. The blood's usually flowing the wrong way in the veins. And when that happens, they get symptoms, whether they really attribute it to the veins or not.
A woman out there with varicose veins.
Yes.
A man. As you say, they think they don't have any symptoms. Okay, just
Right.
the tired legs are just
Right.
a part of life, etc. Okay.
Yes.
Are they headed in the way your mind thinks? Are they headed toward not disaster, but I mean, are they headed? I mean, it's going to get worse.
It may not be disaster, but it's certainly going to get worse. The thing about vein disease is that as long as people are standing upright, the veins are going to get worse.
Okay, but backing up for a moment. Okay, so you do the treatment, big ropey vein.
Yes.
Okay. You choose the treatment.
Yes.
That how long does it take? I mean, how long does the procedure last? And how soon can they walk home? Do they need somebody to drive them?
It takes about 30 minutes to do the procedure. And someone drives them home, usually because I give them some medication to help them relax.
Okay.
But there's really no recovery time after this. And that's what's so surprising to these people. As they're leaving our office, I ask them to go walk for 30 minutes somewhere. And they go outside, then go to the mall, wherever they want to go. But there is no downtime after this procedure. So they're treated, they're walking around, the next day they're back at work or doing whatever they want to do.
So no more varicose veins.
So no more varicose veins.
Shouldn't have varicose veins with technology today.
There's
and
such
stripping.
Yes.
This procedure in a hospital.
Yes.
It's still being done.
It's still being done.
But it doesn't have to be.
It doesn't have to be done. It's really
It's outdated?
It's outdated. It's really there's almost always a better option for that now.
So what should a patient look for in a doctor that's going to be doing this procedure, in your opinion?
I really think you've got to find someone that treats a lot of vein disease and is really comfortable with ultrasound.
Is it fair to say, how long have you been using ultrasound?
I think it's completely fair.
How long have you been using it?
I've been using it for about 20 years now.
20 years.
And I have a lot of experience using ultrasound.
In your mind, do you
Yes.
think that knowing what you know about ultrasound,
Yes.
to do it any other way would just not be as effective, period?
It's not as effective, period.
Okay.
Because you don't, unless you really know what you're looking for and using ultrasound and finding the problem and treating the problem, part of it you're just guessing. And this kind of a thing, it's not like a chest x-ray. You can send someone for a chest x-ray, you get a report back, it says pneumonia, you can treat their pneumonia. Ultrasound's not like that. You've got to hold that transducer, you've got to see which way the blood's flowing, and you've got to sort out which veins need to be treated.
If you're a specialist, okay,
Yes.
does it cost more to go to somebody like you? I mean, insurance covers it anyway.
Insurance covers it anyway, but
If you
no.
have symptoms.
Right. It's not more expensive
So
to
look
see
for a
someone.
specialist.
Look for a specialist, because the thing about going to a specialist also is that they're more efficient. We know what to look for. We find the problem. If we need an ultrasound, I do the ultrasound. There are no wasted steps in this, and so it's a much more effective, efficient way to get it done.
What do you want people to know about what you could do for spider veins?
Well, we can certainly treat spider veins, and my advice to people that have spider veins that are changing the clothes they're wearing, or if they're not swimming and they want to get them addressed, they really should go to someone that treats veins a lot, either a vascular surgeon or an interventional radiologist. And really, the reason for that is that there can frequently be underlying problems in the bigger veins that will cause these spider veins to come back if they're treated. And if the underlying problem's not addressed, it's just not going to work.
We haven't talked about men, but
Right.
if they have heavy legs or
Yes.
varicose veins,
Yes.
if they see veins popping out,
If they see veins popping out, it means that there's abnormal blood flow in there. The circulation is not right in the legs, because normal veins do not bulge out. And so typically,
so it's making their legs heavy.
Yes, and so what it is that vein, usually the blood's going backward in the vein bulges, it gets heavy, it gets sore, and that's really the best time to get these veins evaluated, because it will only get worse over time, and if it goes on long enough, more veins will develop, and then brown areas develop around the ankles, and ulcers develop, and all of that can be prevented when it's treated early.
If you had to say there's a problem in the world
Yes.
of vein elimination
Yes.
nationwide, it's just treating the area.
Yes.
Is that right?
Unfortunately, people really will just treat what you can see, and what really is that the patient describes as the problem. And it may be the symptomatic part where the discomfort is and all that, and I certainly understand that, but the source of it is really what I'm trying to get at.
I want to thank you for coming on the show.
Thank you very much, Randy.
interesting. If you would like to see this interview again, you can go on our website and just put in veins or vein removal or vein elimination or just Dr. Hamilton. And for now, I wish you good health.
Thanks for watching The Wellness Hour.